Welcome back to News Diary. We are having that conversation on today, of course, being World Hepatitis Day, and the theme is One Life, One Liver. And of course, it's just the importance of us knowing the knowledge of, having a healthy liver in your body. And to have that conversation, I have Dr. Chandra Mohan Viparthi. He's a liver transplant and HPB surgeon at the Nairobi West Hospital. Thank you for making time.
Thank you. Good morning.
Right, let's just start with, of course, just understanding the basics.
Yes.
Hepatitis.
Yes.
What is hepatitis? What causes hepatitis also?
Yes. Hepatitis is a broad term which is used for a liver infection or inflammation, wherein there will be a lot of symptoms appearing for the individual suffering from this. And there are many causes which causes hepatitis. May it be the viral hepatitis, which are 5 types, like hepatitis A virus, hepatitis B, C, D, and E.
Right.
These viruses may cause hepatitis, and today the world theme is one life, one liver, right? So this came after Dr. Baruch Bloomberg, who is an American scientist who invented the hepatitis B virus and also the vaccination somewhere in 1960s. He has found out there is this hepatitis B virus which is infecting the population. So one life, one liver is the theme today on the note of Dr. Baruch Bloomberg.
Right. Just for someone to understand, specific symptoms of having hepatitis are what exactly?
Yeah. So when you are suffering from a liver disease or a hepatitis, there will be yellowish discoloration of the eyes, which is commonly termed as jaundice in a local population, right? So, and another one is a dark urine, which is like Coca-Cola colored, or this dark colored urine is evident in some population. And there are subtle symptoms that may present with viral hepatitis or any other hepatitis for that regard. They may suffer from fatigue, generalized weakness, malaise. All these symptoms are experienced, and itchiness of the body. Yeah.
What about causes? Like what causes? What can someone do to actually, what leads to it?
There are viral causes. The viruses hepatitis A, B, C, D, and E are most common in this world. And there is another drug abuse. If you are overusing this paracetamol, which is a painkiller, and we use it for fevers as well. So if you overuse the paracetamol, that may also cause the hepatitis. And there are some innate mechanisms inside our body, which is known as autoimmune hepatitis, our own antibodies inside the body. They will act upon the liver to cause hepatitis. That is known as autoimmune pattern of the disease, hepatitis. Okay, and there is this most prevalent drug abuse, which is alcohol in our population, right? Alcohol can also induce hepatitis, and in fact, it is the major cause of hepatitis in the world now. Okay, next to only diabetes. The diabetes can also cause hepatitis in populations who are not screened properly. Yes.
Away from, of course, the global view, let's talk about Kenya. What is the status of hepatitis patients in the country?
Kenya, in worldwide, we have around 1.2 million deaths annually. So because of this hepatitis, viral hepatitis. In Kenya, around 90,000 of the population are not making it because of the unavailability of the screening and all those other resources. So it is a big problem right now, and it is in fact the 7th leading cause of the deaths worldwide. So it in Kenya, HIV deaths are maybe around 1.2 million or 1 million. This equals the viral hepatitis also equals the deaths which are occurring due to HIV, TB, malaria. It is that big a burden in the population right now in Kenya. Yes.
What about pregnant women? If pregnant women get hepatitis,
yes,
is it very severe?
Yes, in like in normal population there is hepatitis, but in pregnant women they are more vulnerable to the infections, and the disease course is fatal. So now there are advanced drugs in which the pregnant women can be safely guarded during the pregnancy. Yeah.
What is the importance of having a healthy liver? I mean, every part of the body, of course, is important, but like specifically for the liver, connecting it with other organs.
Liver is like a factory inside our body. So it does around 500 different functions in our body. Most of them being the fat-soluble vitamins inside our body, vitamin A, vitamin D, vitamin D, E, and K. These vitamins are absorbed because the liver produces a yellowish fluid known as bile inside our system.
Right.
So these vitamins would be deficient in a patient or in a person who is not having a healthy liver. So when these things happen, there will be disturbances in the vision, there will be disturbances in the bone, and disturbances in the epithelium, the mucosa membranes, and there will be differences in the coagulation pattern inside the body. So patient may bleed. Okay, you may notice bleed from the nose, you may notice bleed from the mouth, gums, and maybe in your stools you may find dark colored stool, and also sometimes red colored stool, which is fatal. Sometimes you may vomit blood. That means you have very severe liver disease.
Right. What about, prevention? Like, what's the best way to prevent not getting hepatitis?
The best way to prevent hepatitis is to avoid all these sources which are causing the hepatitis, meaning the viruses. Hepatitis B vaccination is there, and hepatitis, alcoholic hepatitis, we may stop using alcohol or moderate the consumption of the alcohol and screen properly. Those are the ways we can actually protect our liver. And healthy lifestyle is one of the most important factor which should be considered. And regulating the glucose content inside our body in case of diabetics. Yes.
What about, when it comes to transplant? Is there a liver transplant in the country?
Liver transplant as such, now we are actually doing, I think the Kenyatta National Hospital has started a program there in doing liver resections for any liver cancers which are quite common in the population. So apart from the liver resections, we are not able to make it into the liver transplant due to the unavailability of the infrastructure and the personnel and the different devices required for doing the liver transplant. Yeah.
So that means if there's none in Kenya, one has to travel out of the country to get a
right
transplant.
now they are traveling outside the country. Yes.
What's the cost though?
So in India and in Turkey and in US, Europe and Australia, there are different costing for a liver transplant. In India, we have around 2 million to 4 million packages for the liver transplant. In Turkey, it goes around 5 million to 7 million. And in US and Europe, it should be around 100 million.
That's pretty costly, really.
Correct.
But let's talk about now in terms of like the government. What is the government doing nationally to make sure that such challenges when it comes to hepatitis are dealt with?
The government is accepting some of the WHO strategies in preventing the hepatitis, and they are actually doing a good work in low resource countries like Africa. So they are actually promoting the WHO universal hepatitis B vaccination programs in and around Africa. Around 10 countries has already adopted this universal hepatitis B vaccination. So slowly we may end, or the theme itself says, WHO theme, one life, one liver, the hepatitis eradication by 2030. It may be possible.
Which might be possible.
Which might be possible.
Interesting. Let's talk about, is there any stigma associated with someone having hepatitis?
Yeah, there are several social stigmas which are prevalent in the population, which are like you may get the hepatitis when you interact with the hepatitis B person. It's not like that. There are carriers and there are infective people where we can differentiate them in terms of infectivity, right? So household contacts, they may have to follow some certain hygiene, but it is not like contagious like corona, COVID, all those kinds. So it is a stigma. When the person turns yellow, everybody just delineate them from the society. It is a stigma happening, and Another stigma is that people use herbal medications for getting rid of the hepatitis B virus, which is quite not correct. So we have to go to a proper scientific based drugs so that we can cure this hepatitis. So in fact, the herbal medications, the casa, whatever leaves they chew during the jaundice period, they actually damage the liver rather than giving a good result. Yeah.
As a doctor who deals with hepatitis patients,
Yes.
and some of the signs you've said is they color yellow. How do you advise them, especially when it comes to the stigma that's associated with them? What do you tell them?
Regarding
just that, it's normal, because like we talked about the stigma that's there.
Yes.
How would you advise patients?
So usually the hepatitis resolves by its own. So A and E, they will be resolving on their own. But hepatitis B, it will be latent inside our liver for a very long time. So they will be like carriers. There will be yellowishness of eyes on and off because of the reactivation of the virus within the body. Yes.
How do you raise awareness when it comes to hepatitis in the country?
Raising the awareness by these news channels, social media, and giving some talks, conducting CMEs, conferences. Maybe the government has to involve a lot to create awareness. Yes.
We'll talk about the government in a bit, but in terms of vaccination, is there vaccination when it comes to hepatitis?
Yes, there is vaccination. There is. I am talking about universal hepatitis B vaccination, which has been made mandatory in some governments. Like in different countries, 15 to 59 years, 59 years, they will undergo this vaccination. 19 to 59 years, everybody has to undergo the universal hepatitis B vaccination. And who are dealing with the blood and blood products, and they are doing some healthcare delivery, they are all mandated to take this hepatitis B vaccinations. Yes.
You talked about healthy lifestyle choices.
Yes.
What foods should people avoid to make sure that they don't get affected?
Processed foods mostly. And if you have an unhealthy liver, you should avoid certain fatty foods, because fats are the ones which produce the free radicals and damage the liver more. And you have to drink a lot of fluids, meaning water. So if you weigh around, like if you can count it easily by yourself. So weigh yourself in pounds and then divide by 2, that gives you ounces, how many you have to take per day. So weigh yourself in pounds and divide by 2, that is the ounces you have to take in a day. Yes.
For someone who's living, let's say, not in an urban setting, and they cannot be able to count or like divide by 2, like the way you're talking about.
So ounces is like 30 ml.
Yeah.
So like roughly around 3 liters per day should be enough.
So does that mean one has to take a lot of water just to make sure
to just flush out whatever toxins are present in the body?
Right.
And then eat some green leafy vegetables which are rich in vitamins, vitamin A, carrots, legumes. Yeah.
I want to talk about empowering communities, but before we talk about the government, from where you sit as a doctor, is there any program that, especially let's say from the hospital, to empower communities when it comes to this disease?
So hospital settings, they usually do the screening camps and empower the communities by providing much of the information they need, how to be in the household contacts, how to behave in outside society, what to avoid, and all those things are already being done by the hospitals. The Nairobi West is pioneer in doing that. Yes.
What do you think then the government should do to make this, the situation better when it comes to hepatitis in the country?
So the government has already adapted these vaccination programs and all these awareness campaigns. So slowly they will implement everything to get rid of this hepatitis. But it doesn't happen once. It has to be a slow process, because hepatitis is also associated with HIV. So they have to concentrate on HIV as well, because there is co-infection of hepatitis B or C or any other virus with the HIV. So it is a national program.
What's the connection between the two?
Because in an immunocompromised patient, hepatitis B or C can easily get inside the body.
Okay.
Yes.
Oh, wow. All right. We've talked about, of course, some of the essentials. Maybe now your final tips as we wrap up of just making sure that you have a healthy liver at the end of the day. Yes, we've talked about the food, but just wrap it up for us for now.
So to eliminate the hepatitis, we have so many programs which are going on inside the country and outside the country and worldwide. So one of which is prevention of the mother-to-child transmission. Okay, less than 5 years, they have conducted a study that when children are observed less than 5 years and transmission rates between compared with the adults, there is no big difference. So in sub-Saharan Africa, right? So when we screen the mothers antenatally for the hepatitis B surface antigen, that would make a difference, I think, in my opinion. So hepatitis B surface antigen screening has to be mandated for all the mothers who are undergoing delivery. Okay, so if they are found out that they have this hepatitis B virus or any other virus in the body, and the copies which we say like viral load inside the body is more than 200,000, then we have to initiate a drug known as tenofovir, 300 milligrams daily. So once we do that, the risk of transmission to the child gets significantly low. Okay, so and for the child, when he is born to a hepatitis B mother, they can receive vaccination within 24 hours of the delivery. So this mother-to-child transmission should be decreased. Antenatal screening has to be promoted, and then societies has to be empowered and communicated and informed regarding the different problems we are facing and different causes of the hepatitis, and drink less alcohol, moderate the amount, use the drugs only with the prescription of the doctors. Don't go here and there searching for a magic. People do believe in magic, so
they should go to the hospital
yeah,
and get treated, right?
correct.
All right. Thank you so much for that conversation. That was very interesting. That is Dr. Chandra Mohan Viparthi. He's a liver transplant and HPB surgeon at the Nairobi West Hospital. The conversation, of course, was on Hepatitis Day, today being World Hepatitis Day, and the theme from WHO is One Life, One Liver. That's it for News Diary. Thank you for watching. I'll be back at 10 a.m. with News Center. See you then.